Hello, my name is Will Martinez, and the disease I'm going to be discussing is COPD, or chronic obstructive pulmonary disease. This is a disease that actually encompasses two different disease processes: chronic bronchitis and emphysema. Simply put, emphysema is a disease that damages at the alveolar level, destroying the elasticity and the alveolar walls, whereas chronic bronchitis affects more of the bronchial tubes, destroying the cilia and affecting the cells within that region. There are several factors that contribute to developing COPD. The biggest one being smoking, which is the leading cause of COPD. This is smoking cigarettes and other forms of tobacco, and is the leading cause of COPD um, diagnosis. Another one is environmental factors. So this is things like living in polluted areas or working in toxic environments such as oil well or oil rigs or mines. Genetic factors do play a role in a genetic mutation of your AAT protein, in which you have a deficiency. Respiratory infections, chronic respiratory infections also makes you more susceptible to developing the disease. Symptoms can vary from patient to patient depending on what stage of COPD they're in, as well as if they're in an exacerbative state or not. The most common symptom is shortness of breath. With chronic bronchitis, they'll have a persistent productive cough from that development of mucus in their lungs. Um, Both will have wheezing, chest tightness, and will report fatigue. We can also classify chronic bronchitis sufferers into blue bloaters because they usually are hypoxic and get a blue hue to their body, whereas emphysema are pink puffers. Because of the polycythemia they develop, they become have more of a pink hue and are trying to backfill those alveoli by puffing air or pursed lip breathing. Luckily, there are a variety of treatments, both pre-hospital, in-hospital, and at home for these patients. I'm going to jump over the ambulance real quick to just show a couple of what we use pre-hospital. There are actually a variety of treatments for COPD patients. One very common is albuterol and Atrovent, which is given through a nebulizer here. This helps keep the airway open and dry up secretions. A lot of patients are also put on supplemental oxygen through a nasal cannula, putting those prongs in their nose, connecting to oxygen, and supplementing their oxygen through that. Patients are also can be put on CPAP, which creates positive pressure, pushes air in, keeps those alveoli open, allows them to oxygenate. In many cases, patients will have to be intubated using an ET tube, go in, open up their airway, and a supplemental airway will need to be put in, where they are then ventilated with a bag valve mask, forcing air into those lungs that they're not able to due to their disease process. COPD is actually the third leading cause of death worldwide, causing about 3.23 million deaths in 2019. In the United States, COPD affects roughly 12.5 million Americans, costs billions of dollars in healthcare every year. The prognosis for patients with COPD varies greatly depending on background, age, genetics, body habitus, a ton of other factors. The classification is called a GOLD, or Global Initiative Obstructive Lung Disease classification, to see the severity of a patient's disease. It goes from GOLD 1 being mild to GOLD 4 being very severe. The prognosis for these patients also varies greatly if they smoked, have genetic factors, or anything else. So they could live, if well managed, 10 to 20 years post diagnosis. Thank you so much for watching my presentation. I hope you learned something valuable, and I look forward to discussing it all with you. Thank you.